We're on to activity 30, looking at the anatomy of the heart. We have the list here. And these first two we will omit. We don't have a good place to see those. So we'll start with the visceral pericardium, the serous membrane attached to the heart. And an alternate name here is epicardium. So let's get our labels going. So the visceral pericardium, also known as epicardium, is just the superficial surface of the heart itself, anywhere. The membrane attached to the surface of the heart. And we have the two superior chambers. We'll open it up. And keep in mind, we're viewing a heart from the anterior side. So this space here is the right atrium versus space on the opposite side, the left atrium. Whereas the auricle is now the external flaps outside of the chamber. So superficial to the chamber of the atria, these external flaps here are the auricles, of course, right and left. The ventricles are now the inferior chambers. So we're looking into the right ventricle space and the left ventricle, that space here. Connected on to the right atrium, we have superior to it, this large vein, superior vena cava. And here, just the remnant of what would be a much larger, the actual biggest vein in our body, the inferior vena cava. Both connect and lead into the right atrium. And then moving along from the right ventricle, the artery passing out, it gets the name pulmonary trunk. Trunks are arteries that later have their branches. So in this case, this major pulmonary trunk would branch to the right and left pulmonary arteries. And it's from the posterior side of the heart. Here we're looking at this location of the left atrium would be within here. And leading into the left atrium are the multiple pulmonary veins. So from the lungs, carrying blood from the lungs, the pulmonary veins. Go back to the anterior view, and exiting out of the space of the left ventricle, we have this large artery called the aorta. And specifically, this initial segment is called the ascending aorta that travels upwards. And then as it curves, there's the arch of the aorta. And then, of course, continuing to curve, there's now the descending aorta. If we go back specifically to the arch of the aorta, and we'll just put an A right there for aorta, we have these three branches right on the superior end of it. So the one that's furthest to the right is brachiocephalic. The next one over is a left common carotid, the left common carotid specifically. And then the next one over is the left subclavian. So we said the ABCs from the ascending aorta, the aortic arch, and there's a brachiocephalic trunk. Again, a trunk is an artery that later has branches. The left common carotid artery, and then a left subclavian artery. Here on the anterior portion, not seen well, the anterior interventricular sulcus. We'd be looking for a groove right in this area, a sulcus, a groove. But in this case, the sulcus is covered in fat and blood vessels sit on that notch. And the same concept goes for the posterior interventricular sulcus. Posterior side between the two ventricles, there's a groove, but again, it's filled in with fat. And you notice here a vein sitting right on that posterior interventricular sulcus. So going on to now the coronary arteries, and we'll start with the left coronary artery. And the left coronary artery now has multiple branches. Coming down from here, this is now the anterior interventricular branch of the left coronary artery. And then coming over to the side, this is the circumflex branch of the left coronary artery. Whereas for the right side, just following the right coronary artery around, and it wraps around to the posterior side. And when it wraps around to the posterior side and drops down, that is the posterior interventricular branch for the right coronary artery. We now have veins on the posterior side, and it's traveling from the left side of the heart. So this is a posterior view. And from the left side of the heart, there's what's called the great cardiac vein. From the sulcus itself here, there's a middle cardiac vein. And then from the right side, there's a small cardiac vein. And all three of these veins come together, and it's right at this location, this very large section. That is called the coronary sinus. And the coronary sinus itself is a vein. And then going to the anterior side, connecting this area now where we have the pulmonary arteries and the aorta. This connection between the two is a ligamentum arteriosum. So a ligament between those two major arteries. And at this point, we'll move on to the internal features inside of the heart. And the first one will be difficult to see, and there's a note in the lab manual. So that interatrial septum, this is the border, the wall separating the right and left atrium, and the same concept, interventricular septum, the border between the two ventricles, and we can see where that would be located. So that would be all of the structure here, separating the right ventricle from the left ventricle, that interventricular septum. On the right side, between the atrium and the ventricle, so we have the right atrioventricular valve, or also known as a tricuspid valve. It's another name for it. And now between the right ventricle and the pulmonary trunk, this is where we have a pulmonary valve. And the pulmonary valve leads right into the pulmonary, right into that pulmonary trunk. On the opposite side, we have here what's known as the left atrioventricular valve, or alternate names for it could be bicuspid valve or mitral valve. And then we need another view here. So we're once again seeing that bicuspid valve. And here we're now able to see the aortic valve. And again, we're looking in the area of the left ventricle. And that aortic valve, of course, will lead into the ascending aorta. We can see now attached to the atrioventricular valves, there's the stringy tendon portion, and then it connects into the muscle itself of the ventricle. So we have first what's called the papillary muscles. So we see just follow the AV valve to the tendon structure, and the bulging sections where they connect are the papillary muscles. The strings themselves are called chordae tendineae. And we always have that connection between an atrioventricular valve, chordae tendineae leading to papillary muscle. This happens to be the left atrioventricular valve, but we see the same traits for the right side as well. Whereas now these other ridges of muscle inside the ventricles, these other ridges of muscle that have no connection to the chordae tendineae, These ridges of muscle are known as the trabeculae carneae. And again, you can see the difference. Papillary muscle will have the attached chordae tendineae. The trabeculae carneae will not. And where we started, the epicardium, that first term, epicardium is the surface of the heart, the serous membrane attached to the surface. Just deep to that, the middle layer of tissue made of cardiac muscle is the myocardium. And then noticing the prefix endo, the inside surface of every chamber, just the inner lining, that's a layer known as the endocardium. And one final term now. We have to go back into the space of the right atrium. And we see this little depression here. This is actually a view of the interatrial septum. We're just looking from the right side, looking right at the interatrial septum. And a notch, a depression in that interatrial septum, that is called the fossa ovalis.